into a brighter future. Once upon a time, pharmacy was, and thou shalt make it an holy oil, an holy ointment, an ointment compounded after the art of the apothecary. It shall be holy. I guess you can see pharmacists were supposed to make something that was holy there. On this slide, it's slightly bigger. I just like the other part there that says the leaf thereof for medicine. Again, highlighting that traditional practices and herbal medicine was part and parcel of pharmacy. I hope you can see, but I know all that those who have gone through the history of pharmacy are familiar with these various pictures there, which start from very early practices where people were using virtually anything as remedy. It was even more clinical. Just tracing the history, you'd see that pharmacists were bedsides. Were also manufacturing. Toxicologists were there. And those apothecary shops, which probably would call retail pharmacies now. There were reference books way back then. There were societies. I think we were recommended to be part and parcel of our professional societies. It was in distribution and also in military, if you can see the last picture there. In short, pharmacy was compounding herbal, traditional or ethno medicine, was manufacturing, was even more clinical. Was retail, was wholesaling and distribution, toxicology. There were societies. To me, that history tells me pharmacists were true custodians of drugs or medicines. So, can we say we still that, or have lost ground, or have gained ground? My take is we have just retained a form of glory, of our former glory. I think we have lost, although some would say the profession is grown. I would say the healthcare or the pharmaceutical care industry has just become more complex. So various models have been introduced, pharmaceutical care, self-care, but from it, I would go with that last statement, that specialization in pharmacy. It's more like it's what we have to do. There is no option if we want the profession to stay relevant to itself and also to our consumer. So because I'm saying we've lost ground, I don't really have anything to put on evolution. I would expect people, depending on your conclusions, to fill in. So that's the outlook, ladies and gentlemen. This is a fairly recent article, 2013, and it's an American journal. A looming joblessness crisis for new pharmacy graduates and the implications it holds. Again, the next slide is again doom for the profession. As possible causes, the rate at which our societies are changing, and as well as their expectations. But I think one of the most contributing is that this, I have derived that statement from a research that was done in South Africa, where I think about 52.3% of pharmacy students in that particular school of pharmacy didn't actually hate pharmacy as their first choice. in terms of career path. So as an average, you'd see around 50% of each farmer's class, they don't have it as their first choice. They are forced by circumstances, probably points that did not get high enough for medicine or low enough for another profession. I would probably use myself as an example there. Well, I wouldn't say there was no way I was going to choose pharmacy because I didn't know there was pharmacy anyway. I only knew doctors, nurses, and soldiers and everything because we grew in rural areas. We only see town life because the university was in Harare. So when I got 13 points, and I saw the form saying 13 points is the cutoff for males for farmers, I had no choice, I had to apply. And also our relatives were saying, oh, now that you have been accepted into the degree, it was around about the time where the land reform started, they said, now you are going to get a farm. Then I decided to leave it like that because also I didn't know much about farmers then. But also the economy. The economy put a lot of pressure on people. To the extent that people would move into a sector where they think there is money. But from reliable sources, I know that private pharmacy sector, which is retail, is only worth about 100 million, which is not enough even for one person who wants to be very rich like me. And also the other cause is we are training other institutions to survive without pharmacists. And not many are willing to be part and parcel of policy making. There is no way really you can divorce yourself from policy making and then hope that somehow your interests will be represented. But to me, the major cause is that we are training generic pharmacists. Generic pharmacists, as for someone in retail pharmacy just like me, I would prefer generic pharmacists because they are cheap, because they are easily accessible, because everybody can make them, and also everybody can get them and use them. But to the profession, probably to the profession, it's losing much, its value and everything. So my suggestion is let's move from this generalist pharmacy training approach to a specialist pharmacist training. As you can see from that arrow, it's getting broader in terms of market share. It also increases the size of the market and the value from the 100 million. Specialization would then improve or help us reclaim our former glory. Remember, we were at some point in time we were making holy oil for anointing. I know Zimbabwe has several prophets who are making oil. I don't know whether they are consulting pharmacists there. We have specialist registers where an individual is registered. Let's just use like a hospital pharmacist who can't move into retail or private retail, or who can't move into industry. There are several rewarding, and also the profession would benefit. Specializing means the pharmacist will be able to contribute more, because just by the fact that you are specializing, you focus more on that subject and understand more of that field and be more useful. Again, these are several benefits that you'd see. That comes with specialization. Real tangible benefits to the profession, and also would ensure that all the field of the profession are filled. We currently, I think we have a lot of Isaacs, for those who are familiar with the Bible, Isaacs who love Esau just because of the game meat, and not because he was his son. We would rather need more Rebeccas in the profession who love Jacob just because they love Jacob. And from that incident, you know that Jacob won the battle because there was unconditional love. People are in the profession for the man or for the gain that was being talked about. So they would look for areas where there is gain at the current. But what does it do to the future of the profession? If we have nomads, pharmacists that are nomadic in nature. There are various areas of specializing. Some were suggested as early as 1978. Some might not be as relevant for Zimbabwean context. But again, we can find areas that will suit our Zimbabwean environment. There are several. You can go. Again, there are several. But I would want you to emphasize that the specialization has to be through training. Because if it is just specialized, sorry, I would use, if there is somebody from Kansas Center Farmers, I would use that as an example. I didn't ask for permission to use that. With the powers congested in me, I've given me. That is a form of specialization, some would say. But that is payer and driven. The moment we all nomadic pharmacists saw that there is money in having an oncology pharmacy, there are no barriers we can move in. So that kind of specialization, which does not, there is no standard, there is no certificate, there is no certification, there is nothing anyone within the profession can move into, which again takes away the game meat out of that sector. And people again will move from that sector. So if we will specialize through training, it means your certificate will be saying you are a regulatory pharmacist, implying we will not see you in retail. And also implying that no matter how much the regulatory pharmacy practice won't be paying, you have no option but staying in the regulatory. That way would ensure that all sectors of pharmacy are filled, and also would ensure that pharmacists are doing what they are supposed to do. But it would need things like experience, practical, and also theory training. So my suggestion would be probably from the fourth year of current pharmacy training, students start to specialize in various thematic areas. The hope is that a future where you would see a healthcare consumer saying, I'm doing this because my pharmacist said so. I would love that future, because the current thing, we are not known. People don't actually know why we are there. I've practiced retail pharmacy and I know for a healthcare consumer to trust you, it takes a lot, really a lot. They think you don't know, which means all the training is going to waste, because at the end, people wouldn't want to. So once upon a time in the future, I expect us to do. So in conclusion, specialization is a very timely and necessary step, but it would need more like awareness and a lot of buy-ins from, in this case, the Pharmacist Council of Zimbabwe, PCZ, DPS, MCAZ, on all those other relevant, including also medical schemes. And universities or colleges that are currently training pharmacists in Zimbabwe. Again, from these professional societies that we were recommended to be part of. Those were the references. I hope I've stimulated you to want to be pharmacists who are specialists in their certain or given areas. Probably I would try to read you one poem that I like so much, the Ode to Patient Care. If we speak with the tongues of specialists and consultants and have not love, we will have nothing more than the noise of our own voices and the clanging of pet ideas. If we develop new methods, write new curriculum and learn new techniques, and if we understand all about the 5 stages of dying, so that we are not surprised when a patient is angry or depressed, and yet we have not love, we are useless. If we give up our old anxieties about talking with patients concerning their true feelings, but we have not love, we gain nothing. Love never ends. As for tumor conferences, they will pass away. As for workshops, they will cease. As for in-service training, it will change. For our methods are always imperfect, and our plans often don't work out. When I first became a helper, I thought like an idealist and talked like an expert. As I began to mature, I realized that I too was afraid, and the patient often taught me. For we see only reflections of sickness and death, but someday we will see them face to face. And the time will come when we will know for sure that it is like what it is like. And we will be sorry we never judged, we ever judged. So methods, techniques, case conference, care plans, seminars, small groups, experience counseling, there is all this and much more we shall suggest for gaining insight and increasing effectiveness. But better than all this is love. We expect professionals, pharmacists, and every other professional that is here and not here to love the profession they are in. Love can be learned. If you get into a profession, not by choice like me, but once you are in, learn to love it and be useful. I thank you.
That very good presentation, which I'm hoping has made people to start thinking. What is training? What are the advantages of training? Where does education come in? So I'm going to continue. And as I said, from a theoretical background, assuming that what Mr. Marume has said has touched some of you, we now need to move forward and look exactly at what is training, where does it come from, how is it defined, and what is education. Okay, the title is The Dichotomy and Complementarity of Education and Training as Drivers of Professional Development. I think we have been talking about development in terms of CPD, and precisely that is why that word is in that topic. Okay, so I am going to clarify the distinction between education and training, show how education and training complement each other in sustaining an individual's professional development, CPD, show why the Pharmacists Council of Zimbabwe should focus on training while universities should focus on education. Show at the end which areas of specialization could be achievable through training. That last bit has been done justice by Mr. Marume's presentation, but I'll just add a few more examples to emphasize perhaps which ones should we prioritize. Okay. Why the distinction between education and training is needed is because the employers are increasingly insisting that by the time students graduate, students must be fully functional without any further training needed. You guys have been saying that to us at UZ, and it sounds very reasonable. But you know what? This is a misunderstanding because universities are not in the business of training. We are in the business of educating, believe it or not. I'm just going to expand on that. What is the difference between education and training? Training refers to acquiring know-how. Okay? For example, how to fly a plane, how to drive a car, how to professionally dispense drugs, and how to professionally dispense eye products. Know-how. Whereas education refers to the know why. Okay? It is, if I use the same examples there, it is why a plane should fly, or why does a plane fly, how does it fly, or how a car is able to move, or why drugs should be dispensed professionally, or why eye products should be professionally provided. That is what education is all about. Okay, let's go a bit further. Now, when we take the know why and know how, the know how is learning to think other people's thoughts. Have you ever thought about it? When you are learning the know how, it means someone has put a thought to something, designed a process, okay? And you are now learning how to use it. Okay? Whereas, when we are educating you, we are trying to get you to think your own thoughts. Okay? So you are being taught to think. That's what going to school is all about. Believe it or not, we have lost the idea, but you only go to school to do what? To learn how to think. And you know how difficult it is? You can take a donkey to the river, but you can't make it drink. So you can take a kid to college, but you can't make them think. They have to think on their own. But we take many years to train people how to think, and that's what education is all about. Okay? So an educated student is then flexible to adapt to the changing responsibility of an enlarging job. Mr. Marue just mentioned, if you are trained, you are stuck because you will have learned something and you can't change. If your job changes, you must go for retraining. Okay? That's not to say one is better than the other, because those two complement each other. Okay? So if I have these little tables here, just to summarize, education and training. Education is personal, is the why, is the thinking, is the competence. Whereas training is programmed, and is the how, is the skills development, and is the proficiency. You see the difference there? If you go to the bottom there, what they are not, if you just take these two, competence and proficiency, education's disadvantage is that you can't replicate. So in other words, when you are graded at university, you have to have a 2, 1, and a 3. You have all passed, but you are passing at different levels. But it's acceptable in education. Okay? Whereas when we are talking about training, we want you to meet a certain standard before you can be deemed to be competent, proficient. Okay? There are no benchmarks in education, but also in training, as we have just said, there's no growth. Because if you need to change something that you have been trained in, you must go and retrain. Okay? So another just table there to show you the difference there. Training is practical, is job-oriented, is for skills and enhancement. Education is theoretical, is learned, and is knowledge enhancement. Okay, so let's go to this philosopher here. He's an educational philosopher. He's probably the Albert Einstein of education psychology. Benjamin Bloom came up with two very basic theories that unite education and training. But the first thing he did was he recognized that when you are learning, there are three processes that take place. There's the cognitive learning, there is the affective, and then there's the psychomotor. In other words, you learn the knowledge, but you must be motivated